It's not the current situation, isn't it, ma'am?
Actually we crossed the three waves, ma'am.
Yeah.
First wave and the more of fear, so many lockdowns, so number of mortality and morbidity actually really less comparative to that of second wave, ma'am.
Okay.
Second wave is really a devastating one. So
Yeah.
many death. Actually, our kith and kin also we lost la, in the
Yeah.
second wave.
Yeah, sure, sure.
Second wave is really devastating.
Yeah.
But third wave, just like that, it's a very mild. Maybe it is very highly transmissible one, but number of death and all is very low in case of third wave, ma'am.
Okay.
Hopefully, it will go down now. So we are
Yeah.
expecting this.
Mm.
But the situation is entirely different in China, madam, now.
Yeah, yeah, yeah.
Shanghai and
Mm.
Beijing is experiencing a very bad situation now.
Mm.
Probably that is the second wave for China, madam. For us, we already crossed three wave. So
Yeah.
many mutations also. Big.
Mm. Yes,
So
yes.
hopefully we are thinking we are in a post-COVID situation. But
Okay.
anyway, even in for a post-COVID complications are so many things, madam. For
Okay.
COVID positive patients, now they are experiencing so many complications.
Mm.
Even the right from mild hair loss,
Mm.
even psychiatrical disturbances, and because of thromboembolic manifestation, heart attack like this, even facial no palsy.
Oh.
So the hidden etiology we have to trace, madam. That's what I choose this topic, post-COVID awareness. So many things are there. As a student, they should know. They should educate their relatives now. That's
Yes,
why I
yes.
choose this topic.
Sure, sure, sure. So I think now CMC Vellore, they are in the process of finding out like whether this vaccination could be mixed or it should be the one we have taken. You have to continue that because like once they told like if we mix like it could be better, more immunity could be gained. So many talks were there regarding vaccination.
Actually, there is two different thoughts. So we can't tell. Actually, we are in the middle of the sea, so we
Yeah.
can't tell which one is right, which one is wrong.
Yes.
But as because we are living in an era of evidence based, so some proof should be there. So now the only thing which will help us, we are hoping, is vaccine only. We are having a two type of vaccine. Hope you know we are having a Covaxin and Covishield.
Mhm.
So it will help, madam.
Okay.
That's the thing we are
Let's
expecting.
hope for the better.
Yeah, yeah. Other thought is also there, but in a forum I can't tell this.
Yes, yes. That is
Mhm.
sure. Mm.
Mhm.
You did your UG where, ma'am? PG, I
I
think.
did my MBBS in Tanjore Medical College, ma'am,
Okay, ma'am. Okay.
and diploma in child health in Madurai Medical College, and
Okay.
MD in Keelpark, ma'am. Right now I am at Tiruchi Medical College, so crisscross of Tamil Nadu. I got some experience.
Okay. Mm. Actually, this program is conducted by IEEE forum, madam.
Okay.
So, Brinda madam is the overall in charge for this IEEE. And there are so many IEEE societies. Like madam has initiated and for this EMBS, that is it's a medical society, medical
Biomedical Society, yes.
engineering, yes, medical in engineering society.
Engineering in medicine and biology.
Okay,
Where,
okay, okay, madam. Mhm.
Actually,
so
you can also become a part of this society, ma'am. This is your
Sure,
society,
ma'am.
doctors,
Yeah.
for doctors and engineers, for everyone. This is the common society
Okay, ma'am.
available in IEEE. If you want to publish your paper, you can be a part of this forum.
It's nice, ma'am,
Definitely, a
actually.
very informative society.
Okay, okay. Thank you, madam. I will join for sure.
Whether you have any necessity to publish paper, ma'am, and in your profession?
Yes, madam. As per the NMC guidelines, they are insisting, madam. Minimum 2 papers or 3 papers for our next
Sorry.
promotion. We are in need, madam. So it's
So
very
research is required in all fields.
mandatory.
Mandatory in all fields.
Yeah, yeah.
Mm.
So what is the for your publication, ma'am? What is the journal name and what is the index, ma'am?
Actually, we used to publish papers in Scopus indexed journal, or this conferences, IEEE conferences are allowed. Journals, any their field of
Scopus is
interest.
enough, madam. Actually, for our publications, they are insisting some of the citations. So one of this is Scopus, madam.
Scopus.
Yeah. If it is so, they will accept the paper. But otherwise, they won't accept the paper. Even
Yeah, other journals and all not they are not following the proper quality. That's why they are rejecting. Only the indexed papers are somewhat to some extent
like that, madam.
they are meeting the standards.
Yeah.
That's why they are telling Scopus indexed journal, or even IEEE is Scopus indexed forum only. Out of the paper you publish in IEEE conferences, definitely those papers will be indexed in Scopus.
Okay.
So that's a trust. IEEE provides trust.
Right. I'm also doing some small research. So I will try to publish in your, ma'am, in your journal.
You can also submit the papers for our conference also.
Okay.
We will also. So this is one wonderful forum for researchers. IEEE.
So these are which branch of engineering, madam? The students belongs to?
Engineering, EC students, and all branches we have invited. Since the college closes by 4 o'clock, and by this time only they will be reaching most of the students.
Okay. It's difficult for them also.
But they will join. Definitely they will join.
Okay. No issue, madam. We will wait.
5 minutes will wait, others will start.
What's your experience regarding the COVID, madam? Pandemic?
Ma'am, I have experienced because this time last year I was infected.
Okay. The third wave.
Family, no, second.
Second. Okay. And
Last year this time.
okay, ma'am.
Whole family was infected.
After that injection only. But Covishield or Covaxin. After that injection only, many of them got the COVID impact, ma'am.
Ma'am, the vaccine.
We are afraid of that vaccine. Yeah.
No. Covaxin is an inactivated one. So the vaccine induced or vaccine associated infection is a mild one. Okay. So that means that indicates that vaccine is working on you.
Okay.
So no harm.
No harm in that. Okay.
Because we are not taking the live vaccine. That is an inactivated one. So always we are in a safer side. I'm telling about the Covaxin.
Okay.
I think you all would have even faced a terrible time bearing all those kits, PPE kits and
yes,
things.
madam. Like still we are using this same mask, madam. We got some impressions over our zygoma.
Yeah. So it would have
that's the topic, madam. Today's topic is about that only. This new normal we have to accept. That's the thing I'm going to tell.
Yeah.
Mask and all we have to follow. Even though we are living this post-COVID area, that is period, we have to follow the same thing, madam.
Okay, yeah.
Because no one knows when the next wave will come or when the next mutation will occur. No one knows.
Yeah.
Short time on paper.
Priya, we'll start.
Okay, okay, okay.
Students are joining. அந்த வந்துட்டாங்களா? டீ பிரேக் அப்புறம் வந்துட்டு இருக்காங்க. வந்துருவாங்க. We'll start. Tata Sainandri.
Yes, ma'am. Welcome, everyone. Thank you for joining us for today's talk. Today,
wait 1 minute. Ma'am இருக்காங்களா?
Yes, madam, I'm here.
Yeah. Thank you.
Yeah. So today we are presenting post-COVID awareness presented by Dr. Manati Saptarishi, Diploma in Child Health, Senior Assistant Professor, KAP Vishwanathan Government Medical College, Trichy. I'd like to request Dr. Brinda, Sairam IEEE Captain and Student Branch Counselor to give the welcome address.
Yes, Nandini. Good evening all. Very good evening. And on behalf of Student Branch, IEEE Student Branch and Department of ECE, and on behalf of EMBA Society, I take immense pleasure in welcoming all for this evening webinar session. And today we have speaker Dr. S. Vanati from Vishwanathan Government Medical College, Trichy. And Madam is going to talk about the post-COVID awareness, which is very, very essential for all the members, because last 2 years we all very much struggled with the COVID. We don't know how to take care ourselves first of all, and how to protect ourselves from the COVID as well as from others also. So very tough situation we faced last 2 years, and still we are facing. And today ma'am is going to give some guidance how we can protect ourselves from COVID also. So now I would like to invite Madam to take over this session. Welcome, ma'am.
Thank you, madam. Good evening, everyone.
Good evening, ma'am. Everyone is in the mute.
Madam, how can I change the slide?
Ma'am, you tell me next. If you say next slide, I'll change, ma'am.
Okay, fine, madam. Anyway, thanks for giving this great opportunity. Thank you, students, for your patient listening, actually, because it's our late evening. Anyway, thank you. Madam, please change the slide, ma'am. As Brinda ma'am told, it's almost after 2 years and 3 devastating waves of the pandemic, the biggest lesson learned is that we as a society have to live with the virus, accept the new normal, and deal effectively with post-COVID complication. So the new normal is the normal. Next. So the post-COVID condition is an umbrella term. That means it includes the wide range of physical, mental, and social health consequences that is experienced by some patients that are present 4 or more weeks after COVID infection, and also by patients who are suffering with initially with a mild infection, or even asymptomatic infection patient can also be included. Next. So the post-COVID conditions are heterogeneous. Heterogeneous is nothing but is a mixed one. Homo means same, hetero means mixed one. So the several patterns can be identified in the past 2.5 years. There is maybe the persistent symptoms or new onset late sequelae may be seen, and evolution of symptoms and conditions. So this is attributable to different underlying pathophysiologic processes. Presentation could be complicated by a number of factors. There is a number of factors are involved. May share similarities with other post-viral conditions. So it is very difficult for us to say it is a post-COVID condition or any other infection. So we have to differentiate between a post-COVID condition with that of the other post-viral condition. Next. Next slide. So the post-COVID condition are associated with a spectrum of a physical, social, and a psychological consequences. Okay, next. So commonly reported symptoms are, as many of us may encounter the symptoms during the COVID, it may persist in a post-COVID conditions, may persist for up to 4 weeks, or sometimes it can even persist for 12 weeks or even longer. Some of the symptoms, the most common symptom is dyspnea. There is increased respiratory effort. So that's why we are using a pulse oximeter and all, and the fatigability. So many of the post-COVID patients are experiencing this fatigability, very tired feeling. Then post-exertional malaise, and this cognitive impairment is also common in a school-going children, and cough, chest pain, headache, and this palpitation, arthralgia and myalgia. These are the pain over the muscles, okay? Then abdominal pain. Some patients may experience a diarrhea and sleep disturbances, even fever. Some people can feel the fever and lightheadedness and impaired daily function, rashes, mood swings, and anosmia. During COVID, some people may experience this anosmia, loss of smell and loss of appetite and loss of taste. So this loss of smell and loss of taste can even persist even after the COVID infections. That is, after COVID PCR test shows negative, even after that, after 4 weeks, after 1 month also, some people experience this loss of smell and loss of taste. And in the girls, menstrual cycle irregularities can also occur. These are the common symptoms reported in a post-COVID condition. Okay, next. Okay. For clinical features warranting further evaluation, consider broad range of possible post-COVID condition. So it's very extensive one. So I just want to tell some of only highlighted points only. So depend upon the body system involved. So the post-COVID conditions also varies. So in case of a dermatological involvement, alopecia is very common. That is, hair loss is more common in a post-COVID condition. Like this, in case of endocrine, diabetic mellitus, many people turn to be diabetic positive, and hypothyroidism also very common after COVID infection. Like this, in case of psychiatric, regarding the psychiatry, depression, anxiety, and post-traumatic stress disorder, these are very common in a post-COVID conditions. And hematologic, it is a very important complication. This is pulmonary embolism, arterial thrombosis, venous thromboembolism, and other hypercoagulability. That means this thromboembolism, depend upon the site involved, it causes a different condition. If the thromboembolism, the thrombi go and settle in the heart, means it causes a myocardial infarction. That is commonly called as heart attack. With the same thromboembolism, in case it reaches the brain, means it leads to stroke. So depend upon the site involvement, the symptoms varies. Okay. And most common other conditions are the weight loss, allergies, and reactivation of other viral infection. Like the measles, many previous viral infections, reactivations can occur. So we should be keep an eye over this. Okay, next. So a thorough physical examination for any COVID patient after 4 weeks, after a month, or after 3 months, if they complains of a very small mild headache or a mild respiratory distress or persistent cough, means we have to look after. So a thorough physical examination is mandatory in all post-COVID patient. Especially we have to look for this pulse oximeter, ambulatory pulse oximeter, and all the vital signs should be monitored, especially in case of BP. The systolic BP, if it drops more than 20 millimeter of mercury, or in diastolic BP more than or equal to 10 millimeter of mercury, means that is abnormal. So we should keep an eye on this patient and also look for the any complications, any serious complications. Okay, next. So at this time, No laboratory test can definitely distinguish post-COVID condition from other etiology. This is really very difficult for all the physicians to differentiate whether it belongs to a post-COVID condition or it may be a other etiology. So a positive viral test is not required to establish a diagnosis of post-COVID condition because it is after post-COVID condition. That is, during COVID condition only we can get this viral test, that is RT-PCR is positive. After post-COVID condition, definitely that viral test RT-PCR is negative. So the lab test should be guided by a clinical findings. So depend upon the clinical findings. If the patient complains with a headache, we have to look and analyze what are the causes of the headache. So at the maximum, we can go for MRI of the head. So to look the any thrombus is present, that may be the etiology for this headache. So in case any patient complaint of a chest pain, we have to rule out the myocardial infarction, that is heart attack, because thrombi in the heart can cause this chest pain. So a basic panel of test might be considered between 4 and 12 weeks, and additional test is also required if the symptom persists for 12 weeks or even longer. Next slide. So I'm not going in detail about the basic test and the specialized test. So for basic test, as you all know, because we already do for our during our COVID infection. So all the blood count, that is CBC, complete blood count and electrolytes, and renal function test, liver function test, thyroid function test, and we also look for our vitamin D and B12 deficiency. For this specialized diagnostic test, depend upon the system involved. That is a rheumatological condition, we are doing the panel of the test. Like this coagulation disorders, D-dimer and fibrinogen we are doing. And yes, any doubt? For myocardial injury, troponin test. So these are the specialized diagnostic tests that should be considered if the symptom persists even after 12 weeks or longer. Next. So more evidence is needed to support the utility of the specific imaging test for evaluation of the post-COVID condition. Previously, during the COVID era, that is during the pandemic, if you think that the patient having a COVID means many people they self going for this CT chest and all. But because in the post-COVID condition, if the chest X-ray is normal and having a normal oxygen saturation, CT chest is not at all necessary. Like the CT pulmonary angiogram is not necessary in case of an without an elevated D-dimer or a compatible symptom. In case of a normal thing, when this evidence, this imaging test will not help. It will give only a low yield. More specialized imaging techniques might be required. That is cardiac MRI might be helpful only with the after consultation with the specialist. Okay, next. For most patients, the goal of the medical management is what? Optimize the function and the quality of the life. So to create a comprehensive rehabilitation plan may be helpful for some patients. Many post-COVID conditions can be improved through already established symptom management approaches. So depend upon the symptom only we have to treat. If a patient present with dyspnea, cough means we have to treat accordingly. If the patient present with a fever, headache means we have to treat accordingly for the fever and headache. That is enough. So symptom-based approach is mandatory. Then evidence indicates that holistic support for the patient throughout their illness course can be beneficial. Okay, next. So the previous things are so medical thing. So I don't know how far you can understand this, but at least for you peoples, I want to emphasize this thing. The people with post-COVID condition should continue to follow the CDC's COVID-19 preventive measures. Please keep in mind this SMS. What is SMS? Any of the students please tell. What is SMS? What do you know about SMS? Any student please unmute and tell.
Students, you can even type your answer in
Yeah,
and
the
put it in the
type or
chat
can
box.
unmute and tell.
Because you would have heard so many times.
Yeah, I'm not talking about this, the short
Social
message service.
distancing.
Yes,
Yeah, someone is
Social
answering.
distancing.
very good.
Social distancing, masking, and sanitizing.
Very good, Pa. So it is not a short message service. It is social distancing, masking, and sanitizing. Very good. Next slide, please. So sanitizing means either by using alcohol-based hand rub in a situation where we can't find the soap and water, or otherwise use the soap and water hand wash. So this hand wash technique is very, very important. This is first discovered or invented by the Cygnus Semmelweis. There is a scientist, actually is a intern, MBBS intern. During the puerperal sepsis, that is the same delivery is conducted by only by doctor and also by the matern. All the matern conducted deliveries are healthy. The wound is healthy, but the doctors conducted deliveries are some show some wound sepsis. So most of the patient presented with a wound sepsis. They don't know how it occurs. So the Ignas Semmelweis is the one is the intern person during the final year. That is house surgeonship. He only invented until because during those days they never used this glove and all or hand washing. So Matten only posted in the labor ward. So they conducted only the delivery only. So no infection. But in case of doctors, they're going for postmortem also and coming to the labor ward also. So what is happening? So the infection carried from the postmortem is so from the infection, the patients got infected. So the delivery is conducted by the doctors, show some infection. So this is the thing the Ignas Semmelweis first invented, and he only insisted about the hand washing. Nowadays we forget the name Ignas Semmelweis. So I request all you people, please remind about Ignas Semmelweis, because in this moment there is a post-COVID. After this pandemic, this is the only thing which is going to help us is hand wash. So we have to remind about the Ignas Semmelweis. Okay. So the steps are the 8 steps. Hope you all know the 8 steps. Anyone know how to wash the hand? Anyone? Please come forward. 52 students are there. Anyone? Anyone tell how you are washing your hands in your home? Please tell. Please unmute and tell. What are the steps in washing your hands? Yes.
Hello.
Your audio is not clear. Anyway, someone please try, because this is the important one. At least you learned steps of washing in this lecture means I'm happy. Anyone please? Am I audible to others?
Yes, ma'am. Anand, do you want to say? Bhagat, Anand.
I definitely know.
Yes, I'm.
Yeah, come
Yeah,
forward.
please tell.
Okay.
Hmm.
So firstly, we have to wash, rub it nicely. That is, rub it nicely with soap, and then we have to push our hands. We have to put our hands near to the water and use it wisely. Then only all germs will go off, and our hand will be so clean. So wash it nicely, and then we have to clean with the wiped tissue or cloth
Okay.
thoroughly.
Very good, very good. But how long you have to wash for? Any
Yeah, maximum 1 to 2 minutes we can take.
1 to 2 minutes, you can't you can't do other things. You can wash your hands because you have to wash it.
Yeah, maximum.
And then we are washing.
Yeah, one. Yeah, maximum 1 minute.
20 seconds. 20 seconds, because the contact time should be 20 seconds. And you should know the steps. Minimum 8 steps are there. Anyway, I'm appreciating you. What's your name, huh?
Bhagat.
Bhagat, very good, very
I'm
good.
Bhagat, yeah.
Bhagat, very good.
Thank you.
Okay. Anyway, it includes the 8 steps. Hereafter, I request all you people, please follow all these 8 steps. First one, after wetting your hand with tap water, you have to take the either normal soap is enough. Any soap which is giving a froth, that is enough. I'm not going for any brand and all. Any normal soap which is giving froth is more than enough. So take the soap, and after getting the after rubbing over your palms. So hope you are seeing my hand like or everybody can appreciate my video.
Yes, ma'am. Yes.
Yes, palm to palm. This is the first step you have to do. The next is interlocking the fingers, because these are the areas where the germs are hiding. So after palm to palm, so interlinking, that is interlocking your fingers. Then over the dorsum, this is called dorsum area. So dorsum of the both hands. So over the back side of your fingers as well as your palm. So this is dorsum aspect. Then the leftover is the your thumb. So never miss your thumb. So both the thumb should be okay, should be clean. And after this, you have to clean your tip of the fingers. So the tip of the fingers over the other palm. So both the hands should be clean, both the tip, because in the nail bed only most of the germs are hiding. Okay. After this, up to wrist you have to wash. Then use your water. You have to wash. So these are the steps you have to follow. Hope everyone understand hand washing. It is very, very important. Actually, it is emphasized by Ignas Samuels. Please keep the name of the person also. Okay. So it is very important. Hereafter, you can follow this. Whenever you go and touch your mouth and nose, or before eating or after using your toilet, please wash your hands with soap and water. If it is not possible for you to get the water or soap, at least use the sanitizer. So please keep the small pouch of sanitizer in your bag. Okay. Next slide. Okay. Another thing I want to emphasize is cough etiquette. So cough etiquette is nothing but so you should follow some manners during cough. So don't cough or sneeze in an open air. Always cover your nose and mouth with a tissue paper and discard the tissue paper then and there. Don't keep the tissue paper along with you side because it carries a lot number of germs. So never keep the tissue paper along with you. So use the tissue paper if possible and throw it in a dustbin properly. Or otherwise, if you're not having any tissue paper or a kerchief, you should use your at least your elbow to cover your nose. Because why elbow, not your hand? Because if you are using your hand means next immediately if you meet your friend means you are saying hi and shaking your hands. So that way you are spreading your germs to the other person. In case of if you are using the elbow means the contamination, the spreading of the infection is limited. Okay. So the cough etiquette is very mandatory. Whenever you come across to whenever you touch your nose or mouth, you always wash your hands if possible, or at least use the hand rub. Okay, so the cough etiquette and hand washing, I emphasize this to learn everyone. Okay, next slide. So regarding vaccination, hope you all know, I'm not going to bore you about vaccine. So the commonly available vaccine in India is Covaxin and Covishield. Hope you know everything about Covaxin and Covishield. Covaxin is an inactivated vaccine. So it contains the entire virus. So you know the virus, the first slide I show the virus with some papillomas, the spikes around the virus. So it is a whole virus that is inactivated one. So it is helpful in all ways. And also because it is not a live one, so the side effects and adverse effects are very much limited. But in case of a Covishield, what is Covishield? This is a subunit vaccine. That is a vector-based virus. This adenovirus is a carrier that carries the spike protein. That is a spike, carries only some part of the virus. The spike protein only it carries, and this adenovirus will never cause infection. It carries the spike protein and do the rest. So this is called this is Covishield. So it is a live one, and another thing is adenovirus act as a carrier one. So we don't know what may be the adverse effect or reactions, but till now we are not getting any serious side effects or adverse reactions. But anyway, vaccination is very important at this time. That is the only rescue for us. Okay, next slide. So hope you all know the difference between isolation and quarantine because we come across this pandemic. Anyone tell what is isolation, what is quarantine? Apart from Bhagat, any person? Anyone?
Isolation is like only one person getting themselves locked into a room. A quarantine where the complete set of people who are exposed to it are locked into a room.
Yes, you are right. But the important clinching point is isolation is done for a sick person. Anyone who got or tested positive patient, that patient should be isolated in a separate room or a separate area. Once that person, if he or she is symptom free only, they will come to the common area. But in case of a quarantine, it is not a sick person. Those person who are suspected of having exposed to COVID infection or a COVID positive patient. So, or in a travel, international traveler, these persons should be quarantined in a separate area, and we have to wait for up to 14 days to see for any symptoms. If there is a no symptoms up to 14 days, they should be allowed to roam around. Okay, so this is the difference between isolation and quarantine. Quarantine is for the normal people and isolation is for a sick people. Okay, hope you understand now. Next slide. So this is a purely medical term, but anyway, you should know about this. So the regarding post-COVID awareness means you should know about the complication also. Of course, we learned about the symptoms and all, and what are the systems involved and what are the complications. But this MIS-C is very common in a pediatricians. What do you mean by MIS-C? Means multi-system inflammatory syndrome in children. So many system are involved. So brain, heart, liver. So many systems are involved in a children. That is called a MIS-C. It's a common in a post-COVID condition. Okay. Next slide. So these are the risk factors. What are the risk factors? Which people are getting a worse or which people are in need of a ventilator or an IV mask? Means the older age or any persons presented with a comorbid condition. Comorbid condition means along with COVID positivity condition, these other symptoms, other clinical conditions can also present. Maybe a cardiovascular disease or a COPD. COPD means a chronic obstructive pulmonary disease. That is a bronchial asthma patient or a renal disease patient or a diabetic patient or any systemic inflammation conditions or a coagulation abnormalities patients or any patients presented with a severe illness and multi-organ disinfection. All these comorbid conditions are risk factors. Then complications are, we already discussed this about the pertaining to the system involved. In case of a serious myocardial injury and myocarditis or acute myocardial infarction, heart failure, even cardiomyopathy, arrhythmia means ventricular arrhythmia, okay, like this VF and like this. Then shock and even cardiac arrest may occur. Okay, venous thromboembolic event is very important one. We are bothering about this thromboembolic manifestation only because so many people are presented with even facial palsy because of this thromboembolic manifestation or stroke. Some paralysis or paresthesia can occur. Paralysis means complete loss of use of the limbs, and paresthesia means only the weakness. Okay, next slide. So patient with post-COVID condition might benefit from review of their current preventive care practices. So we should discuss and teach them regarding the nutrition. The nutrition should be a well-balanced diet and increase the physical activity. The sleep should be at least 6 to 8 hours. And regarding stress management, we have to treat an interpersonal relationship and chronic disease management. So any post-COVID conditions, any patient presented with a diabetic or hypertension, they are bothering about the COVID, not treating the diabetic and hypertension. So we insist that patients to take your regular tablets for the diabetic and hypertension. That is important. Okay. Age appropriate preventive health screening and vaccinations may have been delayed due to the pandemic. In case of any patient or positive for the COVID, the vaccination pertaining to the COVID and also other live vaccine should be delayed for minimum 3 months. Okay. Next slide. So knowledge of post-COVID condition is likely to change rapidly with ongoing research. So as I told previously, we are sailing in the mid of the ocean. We don't know which one is right or which one is wrong. So research is underway to define the long-term phases of the COVID-19. With extensive research underway, it is likely that evidence-based treatment practice will evolve over time. We are hoping for that. Okay, next. So finally, the take-home message is COVID-19 is here to stay. There will be no zero COVID condition at all. So don't expect a day will come with a no COVID. So there is a no situation. Okay. Living with COVID is the only option and we must prepare for it. Okay. Vaccine is the best weapon to bring back life to normal. Hope you are all vaccinated. Are you all vaccinated? Are you all vaccinated or not? Anyone? Mostly. Hope so, right?
Yes, yes.
Because nowadays the vaccine is portal is open for even for up to 12 years. So up to 12 years we are vaccinating. Okay. Both Covaxin and Covishield is available. Post-COVID complications are real and many will face them in future. Basic COVID appropriate behavior will have to continue for a long time. What is this COVID appropriate behavior? That is nothing but our SMS. That is social distancing, masking, and sanitization. That is hand washing. These three things. SMS is very important. Even though we can see no COVID patient in and around our workplace or our home. So even after it is, we have to follow this SMS. So social distancing is very mandatory, and mask is also important. Please use your mask properly. So this is the COVID appropriate behavior, and especially the very important thing that is by Ignas Amalwas, hand washing is very, very important. So hope you all follow the hand washing, social distancing, and masking hereafter. Okay. Thank you for giving this great opportunity. Any doubts, please, please tell.
Students, any doubt? You can unmute and you can ask. Aditya?
Yes, ma'am.
Mute all, unmute all.
Everyone can unmute themselves, ma'am.
Okay, you can unmute yourself, you can ask question. Just you can interact with Tamil also. No issues.
Yeah. No
Yeah,
issue.
we belong to எல்லாரும் தமிழ்நாடு தான்.
Yeah.
Whatever the doubt கேட்கல மேம் கிட்ட.
Ma'am, since there are continuous arrival of subvariants like Delta and Omicron, how can we consider how can we be faced that further with all these subvariants, ma'am? Upcoming subvariants.
Sorry, ma, can't get your question, please.
Like, how can we be safe from the upcoming subvariants, ma'am? Like all these Delta, Omicron, and the subvariants like this.
Actually, what's my understanding is you are asking about the variants, alpha, beta, and the Omicron variants,
Yeah.
right? Okay. So this depends upon the genetic sequence only we are telling. Okay. Right now we come across the beta variant and the Omicron variant also. The Delta variant shows our devastating in the pandemic period. Okay. You are talking about the mutation, right?
Yeah, ma'am.
So the mutation is a routine. What is the normal behavior of any living being? That is fitness for the survival. This virus is also trying to live. So for their survival only, they are having some mutations just to overcome our vaccination, just to overcome our sanitation, just to overcome our hand washing, just to overcome all the medications we discovered. So this virus wants to live and give their progeny. That is the aim of the virus. So they mutate every now and then. Not only for this coronavirus, so many organisms are mutating every now and then. So first mutation, we don't know whether this mutation is going to give us such a devastating a disease or only mild infection. So as we all expect in the third wave, shows a variant of concern, VOC. We thought it as a VOC, variant of concern, but what happened ultimately, it shows high transmissibility, but the mortality and morbidity are very low. So we are expecting the next wave. We are praying to God. No, next wave may not occur. But if it occurs, means the transmissibility and mortality and morbidity should be low. So we are expecting that. Okay. Any questions?
Ma'am, I have a query on vaccination. Even after vaccinated with 2 doses, now they are advised to have booster dose. Is that necessary, and how it will be effective?
Okay. Actually, madam, hope you know about the priming. So what is happening during vaccination is very important. So initial dose means first we are giving the virus to our body. So then only our immunological system will sense the virus and produce antibody against the particular virus. So this is what happening. So if any infection occurs, means if the coronavirus enters into our body, what will happen? It thought it does an foreign body and produce the antibody to try to kill this virus. So in order, while on doing this killing process, it will secrete so many cytokines. So the basic pathophysiology behind our COVID infection is this. This is cytochrome, that is cytokine storm only. This cytokines not only kill the virus, but also do so many harmful things to our body. That is the main manifestation or main pathophysiology behind the COVID infection. Okay. So in case of vaccination, first dose we are giving. So first dose means only priming of our immune system will occur. In case of second dose, what will happen? Still more, the immune system becomes stronger. So during our booster doses, what will happen? Our immune system will become stronger and produce the antibody immediately. So that lag period is delayed. So we are more protected. That's why in case of a pulse polio, in polio, we are taking the regular vaccine. In spite of this, we are giving a pulse polio also. So in order to strengthen our immune system, we are giving this, madam. Okay.
One question in the chat. Why kids are not affected more in COVID when compared to adults or elderly people? One question is in the chat box.
It's not so, madam. Kids are also affected. But the number may be low. Because why means because most of the infections are common in the young and reproductive age group, that is active person only, because they are going out, they are getting infected. But most of the kids are in the lockdown, they are inside the home only. That's why most of the kids are protected. So that is the reason, I think. Otherwise, we are having children with the COVID positive, even COVID death occur in a child, madam. It happen.
But it's not disseminated.
What, ma'am?
Not reaching the audience. Actually, only the elder people, they're only reaching the public.
Maybe a myth, madam. Actually, they are inside. They are in a lockdown. They are in a quarantine. So most of the mothers won't allow the kids outside. So they are inside only. That's why they may not get infection.
Maybe safe environment.
Yeah.
We are keeping
likewise, madam, most of the women are not infected because they are only inside the kitchen most of the time.
Yes.
That's the issue.
Only the gents are going outside, they are getting the disease.
I'm not telling the gents, madam.
Not only those who are moving outside. Yes.
So who are active and going out means they are getting infection. Maybe a male, maybe a female. So gender, apart from gender bias, they are going out. Who are roaming around got the infection.
Yes, exactly. Right reason, ma'am. Yes. Is any other question, students?
Good evening, ma'am.
Yes.
I'm Aditya, the student chairman of the group IEEE group of Sairam College. Happy to have you here, ma'am. I have a small doubt, ma'am.
Please.
The Pfizer vaccination increases it causes inflammation of heart. Can we know the reason behind that?
Sorry, what you were asking?
Pfizer vaccine. After Pfizer vaccination, reports, according to news reports, it has been said that there has been an inflammation in the heart, and many people have passed away due to this inflammation.
No, we can't tell this without any proof or evidence. We can't tell this. Actually, not only for this COVID, for any infection, for any vaccine. Because one vaccine or one drug, commonly we can take it as any drug. If one drug act to me in some way, the same drug will act to you on a different way. We can't tell which drug. That is called a pharmacokinetic and pharmacodynamic. Pharmacodynamic means what the drug does to our body. Pharmacokinetic means how our body responds to the drug. So depend upon this pharmacodynamic and pharmacokinetic only, everything happens. So the same drug will protect me, and the same drug, in case of any allergic person, if you are giving, what will happen? That hypersensitivity reaction will occur and ultimately may end in a death also. So it purely depends upon the pharmacodynamic and pharmacokinetic. So we can't tell 100% this drug is safe or 100% this drug is allergic to someone. It's not so, because every human being is unique in this universe. So everyone is reacting differently. So we can't blame everything on the drug or any new invention. Okay. So,
is it possible with the help of a blood test where we can find that what kind of drug will be effective for the person? Because as you said, each vaccine will have a different drug. Is there any kind of a blood test or any other method where we can find that that person is capable or effective for that particular drug?
Yeah, we are doing, that is called a sensitivity. Antimicrobial susceptibility test we are doing. So if you are infected with any urinary tract infection, means we are taking urine for culture. All the culture, we are, after doing the culture, we are doing if any organism grows, if a Klebsiella or E. coli grown, means we are doing a susceptibility test. So if that organism is sensitive to this, some drugs means we are giving these drugs are sensitive to this organism. So based on this sensitivity test only, they are treating in all hospitals. So if vancomycin may be sensitive to you, but may not to me, because that is a vancomycin resistant enterococcus, means it may not helpful for me. So that's the thing. We are doing a susceptibility test for all organism, right from the bacteria to the fungus also we are doing. Okay. That is called culture report, culture and sensitivity report. During a blood culture we are taking, urine culture we are taking, so many cultures. Depend upon the infection, we are taking the specimens and doing the culture and sensitivity. Okay.
Any other questions from staffs or students? Any questions?
நான் நிறைய கேப்பீங்கன்னு எதிர்பார்த்தேன்.
அதுதான்
கோவிட்னால நிறைய உங்களுக்கு டவுட் இருக்கும். சரி நம்மளும் பேசலாம் அப்படின்னு சொல்லிட்டு தான் ஆசையா இந்த டாபிக்ஸ்.
How about the food habits, ma'am? Food habits.
For what? For food habits for
this post-COVID.
Any specific food?
Any specific food, like they say protein rich.
Madam, as far ma'am, it's my personal opinion, balanced diet is
always
enough, madam. Balanced diet is enough. So if it is available in your home, that is enough, madam. You are not going for this high protein diet or the protein mix and all is not at all necessary. You should take some vegetables or fruits, some amount of rice. Along with this, if you are a non-vegetarian, go for an egg or milk like this, madam. So whatever thing available, please take the balanced diet. Don't go for only meat, only high protein diet. That is not helpful. So always a balanced diet along with the greeneries. That is keera definitely setukanum neenga. So like this only vegetables and fruits. So that is enough.
So throughout the year, even before or after, what are the situation,
yes,
balanced diet is advisable.
Then madam திருமூலர் சொல்லிருக்காரு உணவே மருந்துன்னு சொல்லி.
மருந்து, exactly. உணவே மருந்து, அதுதான் கரெக்ட்.
உடம்பை வளர்த்தேனே உயிர் வளர்த்தேனேன்னு சொல்லிருக்காரு. சோ நம்ம என்ன சாப்பிடுறோமோ அதுதான் நமக்கு. சோ எல்லாம் சாப்பிடுறதையும் நீங்க காஷியஸா எடுத்துக்கணும். என்ன சாப்பிடுறோங்கிறத காஷியஸா எடுத்துட்டாலே போதும். நம்ம இந்த பர்கர் பக்கம், பீஸா பக்கம், ஷவர்மா பக்கம் எல்லாம் போக மாட்டோம்.
எக்ஸாக்ட்லி, அதுலதான் நிறைய இப்ப பிரச்சனை வருது.
பிகாஸ் வெனிகர் ஆட் பண்றதுனால அது கெட்டு போனதா இல்லையானே நமக்கு தெரியாது. பிகாஸ் அந்த மோர் தென் திஸ் இந்த போஸ்ட் கோவிட்ல வந்து எல்லாத்துக்கும் லாஸ் ஆஃப் டேஸ்ட், அதெல்லாம் லாஸ் ஆஃப் ஸ்மெல் போயிட்டதுனால நிறைய பேர் ஷவர்மா சாப்பிடுறாங்க. அதுல கெட்டு போனதா கெட்டு போலையானே நிறைய பேருக்கு தெரியறது இல்ல. மேபி
கரெக்ட்டா, எக்ஸாக்ட்லி மேம், கரெக்ட்டா சொன்னீங்க. அதுல எது கெட்டு போச்சுன்னு எப்படி கண்டுபிடி? எல்லாமே பிரிசர்வேட்டிவ் இருக்கு.
வினிகர் ஆட் பண்றாங்க. வினிகர் ஆட் பண்ணா எதுவுமே தெரியாது மேடம். தெரியாது.
எக்ஸாக்ட்லி. சோ அது தெரியாம டேஸ்டா இருக்குன்னு சாப்பிடுறாங்க எல்லாரும் வெளியில போயிட்டு மாட்டிக்கிறாங்க. கரெக்ட்.
ஃபாஸ்ட் ஃபுட் அவாய்ட் பண்ணுங்க. நமக்கு ஹோம் அவைலபிள் என்ன ஃபுட் இருக்கோ நம்ம நேச்சர் ஃபுட் சாப்பிடுங்க. நம்ம சொல்லுவோம் மேடம், நம்ம வீட்லயே நம்ம பிள்ளைங்க எல்லாம் கேட்க மாட்டாங்க. இத
இருந்தாலும் நம்ம சொல்லணும்
மேடம்.
கேட்கலனாலும் நம்ம சொல்லணும். தட்ஸ் அவர் டியூட்டி.
நம்ம கடமை இல்ல மேடம் சொல்லணும்.
கடமை சொல்லிட்டே இருப்போம். கேக்குறவங்க கேட்கட்டும். அதுதான், நாம அதுக்கு வந்து டயர்ட் ஆகவே கூடாது. ஏன்னா நம்ம பெரியவங்க நமக்கு அப்படிதான் சொல்லிட்டே இருந்தாங்க நான் ஸ்டாப்பா.
எஸ் மேடம்.
அதனால நம்ம அதை ஃபாலோ பண்ணுவோம்.
எஸ் மேடம்.
ஓகே.
அந்த மாஸ்க் கூட வந்து முன்னாடி சொல்லிட்டு இருந்தாங்கல்ல, லைக் சர்ஜிக்கல் மாஸ்க்லாம் வந்து டாக்டர்ஸ்க்கு தான் தேவை, அந்த மாதிரி மாஸ்க் நீங்க யூஸ் பண்ண வேண்டாம் அப்படின்னு சொன்னாங்கல்ல. பட் நம்ம இப்போ எல்லாம் காட்டன் மாஸ்க் அந்த மாஸ்க் எல்லாம் வந்துருச்சு
மேடம். காட்டன் மாஸ்க் வந்து உங்களுக்கு நீங்க ஒண்ணும் இல்ல மேடம். மாஸ்க் நீங்க போட் வச்சிருக்க மாஸ்க் வாட் எவர் மேபி, இட்ஸ் 3-play மாஸ்க் ஆர் காட்டன் மாஸ்க் ஆர் N95 மாஸ்க் வாட் எவர் த மேபி, நீங்க அதை போட்டுட்டு முன்னாடி ஒரு கேன்ல வச்சு ஊதி பாருங்களேன். நம்மளோட என்ன கான்செப்ட் பிஹைண்ட் என்னன்னா, நம்ம வந்து வெளியே இருக்க முன்னாடி வந்து டிராப்லெட் இன்ஃபெக்ஷன் சொன்னாங்க. இப்ப அதெல்லாம் கிடையாது, அது ஏரோசலைசேஷன் சொல்லிட்டாங்க. சோ எல்லா இடமும் இப்ப கிட்ட தான் இருக்கும். ஒருத்த வந்து ஒரு 2 மணி நேரத்துக்கு முன்னாடி கோவிட் பாசிட்டிவ் பேஷண்ட் அங்க இருந்துட்டு போனாங்கன்னா they will left the virus there. So if you come across that same area means we can inhale the virus and we may got infection. So நம்ம மாஸ்க் போட்டு ப்ளோ பண்ணி பார்த்து அந்த இது அணைஞ்சிச்சுன்னு சொன்னா அந்த மாஸ்க் உங்களுக்கு ப்ரொடெக்ட் பண்ணாது. The virus are very small. It's ultra filterable madam. That is the difference between a bacteria and a virus. So அது எப்படி கிராஸ் பண்ணாம நம்ம இருக்கணும் அந்த மாதிரி மாஸ்க் மேடம். நீங்க போட்டுட்டு ஊதி பாத்தீங்கன்னா வெளியே காத்து வந்துச்சுன்னா that mask won't protect you. அவ்வளவுதான். So definitely cotton mask won't protect them. அது சும்மா நம்ம போலீஸ்க்காக போட்டுக்கிறது அந்த மாதிரி எல்லாம் போட்டுக்கலாம் ஒழிய அது won't help. Definitely won't help.
Okay. Thank you.
Okay madam.
Any specific questions from student side? உங்களுக்கு என்னென்ன இஷ்யூஸ் இருந்தா கேட்கலாமா மேடம் கிட்ட? இதான் சான்ஸ்.
எல்லாரும் அமைதியா
ஏன்னா
இருக்காங்க.
ஆமா, மத்த டைம்ல எல்லாரும் பிஸியா இருப்போம். இதான் சான்ஸ் நம்ம கேட்கறதுக்கு. ஏன்னா டாக்டர்ஸ் ஆல்வேஸ் பிஸி தான், எனக்கு தெரியும்.
அப்படிலாம் இல்ல மேடம்.
நீங்களாம் அவைலபிளா இருக்கும்போது எல்லா கொஸ்டின் கேட்டுறணும்.
யங் ஜெனரேஷனுக்கு டீச் பண்ணும்போது ஏதோ சம்திங் அவங்க தெரிஞ்சுக்கிட்டாங்கன்னா இட்ஸ் ஹாப்பி ஃபார் மீ ஆல்சோ. ஸோ இந்த ஹேண்ட் வாஷிங் இதெல்லாமே வந்து நம்ம பண்ணணும் மேடம். ஸோ அந்த 6 ஸ்டெப்ஸ் ஃபாலோ பண்ணணும். 20 செகண்ட்ஸ் ஆச்சும் வாஷ் பண்ணணும். நம்ம இங்க 20 செகண்ட் பண்றோம், ஜஸ்ட் போயிட்டு ½ செகண்ட் கூட இல்ல வாஷ் பண்ணிட்டு வரோம். நம்ம தம்பி 1 மினிட்னு சொன்னாங்க, 1 மினிட்லாம் வாஷ் பண்றதே கிடையாது நம்ம. ஸோ அட்லீஸ்ட் 20 செகண்ட்ஸ் ஆச்சும் அந்த கான்டாக்ட் டைம் இருக்கணும். அப்படின்னா தான் அந்த ஃப்ராத்ல வந்து, பிகாஸ் மோஸ்ட் ஆஃப் த வைரஸ் எல்லாம் வந்து இப்ப நம்ம கொரோனாவே எடுத்துட்டு இட்ஸ் என்வெலப்டு வைரஸ் மேடம். என்வெலப்டு மீன்ஸ் த அவுட்டர் சர்ஃபேஸ் இஸ் contain some lipid content. So the soap always dissolve the lipids. So what will happen? Soap பண்ணோனே இந்த வெளிய இருக்க outer layer lipid dissolve வரதுனால உள்ள இருக்க எல்லாமே disintegrate ஆயிருது. So this is the way the virus are killing in while washing. So அந்த கான்டாக்ட் டைம் இருந்தாதான் நம்ம அது நமக்கு யூஸ்ஃபுல்லா இருக்கும். ஜஸ்ட் லைக் தட் பண்ணிட்டு வந்தோம்னா இட் won't help.
இன்னொரு கொஸ்டின் ஜென்ரலா எல்லாரும் பேசிட்டு இருக்கிறது, சரி நம்ம சானிடைசர் யூஸ் பண்றோம், அதுவே வந்து ஏன் நமக்கு சானிடைசரே போயிருக்கணும் இல்லையா, அந்த ஜெர்ம்ஸ் எல்லாம் ஏன் வந்து அத மீறி வந்து நம்ம கோவிட் வருது அப்படின்னு எல்லாரும் சும்மா ஜாலியா பேசிட்டு இருக்கவங்க சொல்றது, அது என்ன மேம் சொல்றீங்க? இப்ப சானிடைசர் யூஸ் பண்ணாலும் நம்ம கிட்ட இருக்க இந்த ஜெர்ம்ஸ் எல்லாம் போயிடணும் இல்லையா, கோவிட் ஜெர்ம்ஸ் வாட் எவர் ஜெர்ம்ஸ், அதே போக மாட்டேங்குது, அப்புறம் ஏன் நம்ம அதை யூஸ் பண்றோம் அப்படின்னு கேக்குறாங்க.
மேடம் அது போக மாட்டேங்கலாம் கிடையாது மேடம். நீங்க சானிடைசர் வாங்கும்போது நல்ல வேலை ஞாபகப்படுத்துறீங்க, நான் சொல்றேன். சானிடைசர் வாங்கும்போது we should look for the concentration of the alcohol மேடம். எத்தனை பேர் அதை பாக்குறோம்? நம்ம பிராண்ட் பார்த்துட்டு வாங்கிட்டு போறோம், we never look into the concentration of the alcohol. It should be minimum 85% and above madam. But most of the available in market is less than 70 or 60%. That won't help at all. So நாங்க வந்து as per the WHO recommendation 85% மேல நம்மளே ஹோம்மேடா பண்ணிக்கலாம் மேடம் நம்ம. ஸோ நிறைய பேர் இப்ப எங்க ப்ரொஃபஸர்லாம் இங்க வந்து அவங்க ரெடி பண்ணி த்ரூ அவுட் ஜிஹெச் அது மாதிரிலாம் சப்ளை எல்லாம் கொடுத்தாங்க. ஸோ இந்த ஐசோப்ரோபைல் ஆல்கஹால் எடுத்துட்டு அதுல நம்ம கை ட்ரை ஆகாம இருக்குது கிளிசரின் இதெல்லாம் ஆட் பண்ணி, ஸோ மினிமம் கான்சென்ட்ரேஷன் ஆல்கஹால் மீட்டர் அமேசான்லயே விக்குது மேடம். அதுல பார்த்தோம்னா நம்ம எவ்வளவு ஆல்கஹால் கான்சென்ட்ரேஷன் இருக்குன்னு தெரியும். அது மினிமம் 85% இருந்துச்சுன்னா தான் இட் வில் ப்ரொடெக்ட் பண்ணும். நம்ம வந்து சப்நார்மலா அந்த குவாலிட்டியா இல்லாததை யூஸ் பண்ணிக்கிட்டு நம்ம ப்ரொடெக்ட் பண்ணோம்னா how far madam?
சானிடைசர்னால இப்போ ஃப்ளேவர்டு சானிடைசர்ஸ்லாம் வந்துருச்சு வேற.
அதெல்லாம் சொல்லுவாங்க மேடம், but we have to look the 85% alcohol is present or not. That's the thing we have to look for. அந்த ஃப்ளேவர்ல நமக்கு வேணாம் மேடம்.
ரொம்ப நாளா இந்த டவுட் இருந்துட்டே இருந்துச்சு எங்களுக்கு. எல்லாரும் சானிடைசரோட தான் போவாங்க, எங்க போனாலுமே காலேஜ்ல ஒரு சின்ன சானிடைசர் கையில வச்சுட்டு தான் இருப்பாங்க. அதை நம்பிக்கையோட யூஸ் பண்ணிட்டு போவாங்க. அதுல யூஸ் இருக்கா இல்லையான்னு எனக்கு டவுட் ரொம்ப நாளா.
It will help madam, definitely it will help. எல்லா இடமும் நமக்கு தண்ணியும் சோப்பும் கிடைக்காது. அந்த மாதிரி நேரத்துல நம்ம வந்து சானிடைசர் யூஸ் பண்றது is okay, well and good.
அந்த டைம் on the spot வந்து அத at least we can protect, அந்த ஒரு ஆங்கிள் கிடைக்கும்.
மேடம் what the soap did, soap என்ன பண்ணுதோ அதே வேலையை தான் இங்க ஆல்கஹால் பண்ணுது. ஆல்கஹால் dissolve the lipids. நம்ம முன்னாடி 8th ஸ்டாண்டர்ட்லயே படிச்சிருக்கோம்ல மேடம், அசிட்டோன் and ஆல்கஹால் வந்து lipids வந்து dissolve பண்ணனும்னு சொல்லிட்டேன். The same thing, the outer shell of the virus contains the lipids. So the alcohol will dissolve the lipids. That's the way the core, nuclear core will disintegrate. So it kills the virus ultimately. நம்ம 8th ல படிச்சதா மேடம், நம்ம அதான் அப்ளை பண்ண மாட்டேங்கிறோம்.
அத அப்ளை பண்றது இல்ல, மறந்துடுது.
தெரியும் அசிட்டோன் ஆல்கஹால் டிசால்வ் பண்ணுதுன்னு, பட் the function of the
where we are using அது ஞாபகம் வரது இல்ல, அப்ளை பண்றது இல்ல.
அதுதான் மேடம்.
yes. Okay, any questions? Okay ma'am.
பகத் சொல்லுப்பா.
மேடம் this is பகத்.
பகத் சொல்லுப்பா.
கேக்குதுங்களா மேடம்?
கேக்குது சொல்லுங்க. Okay, என்ன क्वेश्चन உங்க?
ஆக்சுவலி ஜூன் மாசத்துக்கு மேல கோவிட் இன்க்ரீஸ் ஆகும்னு சொன்னாங்க. ஓகே, ஜூன் மாசத்துக்கு மேல கோவிட் அதிகமாகும்னு சொன்னாங்க இல்லைங்களா, அது எந்த அளவுக்கு எஃபெக்ட் வரும், ஏதாவது உங்க கருத்து, ஒபினியன்?
ஹாரோஸ்கோப்
அது நாம எப்படி சேஃப்டி பிரிகாஷன்ஸ் பண்ண முடியும்?
ஹாரோஸ்கோப் படிக்கல, அலோபதி தான் படிச்சேன்.
So please share your suggestions and opinions.
இல்ல right
அது
she is right, but இது என்னன்னா we can't predict or we can't tell when will come or not. 2019 டிசம்பர்ல சைனால வந்தது. நமக்கு வந்து அப்ப அங்க இருக்கு நமக்குலாம் வராதுன்னு நினைச்சோம். பட் அல்டிமேட்லி வாட் ஹேப்பன் இந்த 2 இயர்ஸ்ல வந்து ஒரு டிவாஸ்டேட்டிங் வேவ் ஆஃப் பேண்டமிக்கை நம்ம என்கவுண்டர் பண்ண மாதிரி இருந்தது. ஸோ ஹோப்ஃபுல்லி அடுத்தடுத்த வர மியூட்டேஷன் வந்து மேபி நம்ம ரொம்ப சிவியரா இல்லாம விருலண்டா இல்லாம இருக்கும்னு சொல்லி நம்ம எல்லாரும் கடவுள்கிட்ட வேண்டிக்கலாம். அவ்வளவுதான் பண்ண முடியும் இல்லையா? நெக்ஸ்ட் வேவ் வருமா வராதா, வந்துச்சுன்னா ரொம்ப மார்டாலிட்டி இருக்குமா இல்ல ரொம்ப டெத் நடக்குமா இல்லையாங்கிறது we can't tell, but we are hoping for the best, we will pray. அவ்வளவுதான். ஓகே, எனிவே நான் சொன்ன ஆன்சர் உங்களுக்கு சாட்டிஸ்ஃபை பண்ணுச்சா பகத்?
எக்ஸாக்ட்லி மேம், இதான் கரெக்ட்.
Thank you.
ஓகே, வெல்கம்.
ஓகே
Okay. Yeah.
Thank you பா.
Yeah.
Dr. Senandini?
Yes, ma'am. There's another question in the chat box.
Yeah,
Simple question. Lockdown இருக்குமா?
அதுவே மேடம் சொல்ல முடியாது.
ஆன்லைன் கிளாஸ் வேணுமா உங்களுக்கு?
No, horoscope.
மேம் வந்து பொலிட்டிஷியன் இல்ல.
ஆன்லைன் கிளாஸ் வேணும் போல மேடம் அவங்களுக்குலாம். லாக்டவுனே வந்தாலும் உங்க காலேஜ்க்கு மட்டும் கிளாஸ்க்கு நேரா வர சொல்ல போறாங்கப்பா.
இல்ல 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 இல்ல, அவங்களுக்கு இப்ப எக்ஸாம் வர போகுது, அதனால உங்ககிட்ட கேட்டுக்கறாங்க. ஆன்லைன் they are expecting ஆன்லைன் எக்ஸாம்.
அப்படில கேसेस நிறைய இருந்தது. இப்போ வந்து இன் ஜெனரலா வந்து இப்ப ரைட் நோ சிச்சுவேஷன் இஸ் we are having a very meager amount of cases, 1 or 2 cases positive per day. சோ அதுக்கு வந்து இப்ப லாக்டவுன் வந்து இப்ப சொல்ல மாட்டேன், இப்போதைக்கு வர்றதுக்கு சாத்தியக்கூறுகள் ரொம்ப கம்மிப்பா. நம்மளும் அதே பொலிட்டிஷியன் மாதிரியே பேசிடலாம்,
பேச வேண்டியதா இருக்குது. அவங்களுக்கு என்ன क्वेश्चन அத அவங்க கேட்டாங்க. சூப்பர் சூப்பர்.
Thank you very much, ma'am, for your valuable information.
Yeah.
It will definitely help us in the future.
Thank you. Please spread the knowledge to others also, to our relatives and kids. Okay.
Yes, ma'am.
Yes, ma'am.
Also, participants, please fill the feedback form that's posted in the chat box.
Nandini,
Thank you.
formal vote of thanks.
Yes, ma'am. I would like to request Dr. E. Priya, ma'am, to give the vote of thanks.
Thank you, ma'am. So, good evening to one and all present here. It's my privilege to propose a vote of thanks as a faculty advisor of IEEE Engineering in Medicine and Biology. I would really my heartfelt thanks to Dr. Vanati madam. Like in a short span of time, she readily accepted our invitation, and it was really a wonderful, lively talk. Like we had so many interactive questions. We got our doubts being cleared. Thanks a lot, ma'am. Thanks a lot, and. I should really thank Chitra too, Chitra madam. Like through Chitra only we got your contact. So thank you, Chitra. And I would really thank our management, CEO, principal sir, HOD sir, for encouraging us to conduct such events for the benefit of the faculty as well as the students. And I even thank our IEEE student chairman and our student branch counselor, Dr. Brinda, Professor EC department, for taking initiative in conducting such different activities, IEEE society activities. Thanks a lot. And I thank all the student members and the faculty members for joining this webinar. Though it is a weekend, thank you students for your active participation. Thank you faculty members. Hope we'll meet again in another such wonderful session. Thank you.
Thank you, madam.
Thank you,
for
ma'am.
giving the great opportunity to me to share my some of thoughts to you. Anyway, thank you for the patient listening of all the students. Thank you for giving the great opportunity, especially to Chitra.
Yeah.
Thank you, ma'am. Thank you so much.
Thank you. Thank you. Thank you.
Thank you, ma'am. Bye.
Thank you, ma'am.
Thank you, ma'am.